Have you ever stood up feeling perfectly fine, only to notice your legs tighten, throb, or cramp after just a few steps? It's easy to brush it off. Maybe you blame it on a long day. Maybe you chalk it up to just getting older. But when that discomfort shows up predictably with movement and goes away when you rest, that's not random. It can be your circulation quietly asking for attention. This is often a sign of peripheral artery disease, or PAD. It's one of the most common circulation problems, especially for those of us over 50. The really challenging part is that it often develops slowly, without any dramatic moment or loud alarm. It just sends small, repeatable signals. Let's break down exactly what's happening. Nice and simple. Your leg muscles need oxygen to work. Every single time you walk, climb a flight of stairs, or even stand for a few minutes, those muscles are calling for a steady supply of oxygen-rich blood. Your heart is the engine, pushing that blood through a network of arteries that travel all the way down into your thighs, your calves, and your feet. When those arteries are open and flexible, blood flows easily. Your muscles get all the fuel they need, and walking feels totally normal. But over time, something called plaque can start to build up inside your artery walls. This plaque is made of things like fatty deposits and cholesterol. As more and more of it accumulates, the artery gets narrower. It becomes stiffer. The pathway for blood gets smaller and smaller. Now, here's the key part. While you're sitting on the couch or resting, your legs don't need a whole lot of oxygen. So even with narrowed arteries, you might feel completely fine. The problem only really shows up when you start to move. The very moment your muscles demand more oxygen, those narrowed arteries might not be able to deliver enough blood to keep up. That gap between supply and demand is what creates the pain. This is exactly why PAD so often causes discomfort during activity that magically gets better with rest. You might feel it as a cramp in your calf. It could be a deep ache in your thigh, or just a heavy, tired sensation after walking a surprisingly short distance. Then, you stop for a minute. You rest, and within a few minutes, the pain eases away. Because it goes away so reliably, many people learn to ignore it. They just think, well, I guess I can't walk as far as I used to. But here is what is really important to understand. PAD is so much more than just a leg issue. It's a powerful sign of artery disease throughout your body. The same process that's narrowing the arteries in your legs can also be happening in the arteries that supply your heart and your brain. That's precisely why having PAD significantly raises the risk of a heart attack or a stroke. It's a system-wide warning. And here's something else that is critical to know. Not everyone with PAD feels that classic pain. The signs can be much more subtle. Some people might just notice that one or both of their feet feel colder than the rest of their body. Others might see changes in the skin on their legs. It might look shiny or thin. Maybe the toenails grow much more slowly than they used to. You might also notice that the hair on your lower legs seems to be disappearing. Or perhaps small cuts and sores on your feet take a very long time to heal. In more advanced cases, a doctor might find a weak or even absent pulse in the feet. Sometimes, the only clue at all is a slow reduction in your endurance. A distance you used to walk comfortably just becomes shorter and shorter over time. So, who is most at risk for developing PAD? Well, age definitely plays a role. After 50, our arteries naturally lose some of their elasticity. But the risk goes up significantly if you smoke, have diabetes, high blood pressure, or elevated cholesterol. All of these conditions can damage the delicate inner lining of your blood vessels, which speeds up that plaque buildup. If you happen to live with diabetes, PAD can be especially quiet and sneaky. The nerve damage that can come with diabetes, known as neuropathy, may actually reduce your sensation of pain. This allows serious circulation problems to progress further without giving you those obvious warning signs. But here is the encouraging news. PAD can very often be managed, especially when it's caught in its early stages. In fact, one of the single most effective strategies is something called structured walking. This involves walking until you feel that mild discomfort, then resting until it goes away, and then repeating the cycle. This simple process actually stimulates your body to grow small, new alternative blood vessels. Think of it like building natural detours around the narrowed areas in your arteries. Of course, managing your blood pressure, cholesterol, and blood sugar is equally important. Your doctor might also prescribe medications that can help improve blood flow or reduce your risk of forming clots. In more serious cases, specialists can even perform minimally invasive procedures to open up blocked arteries and restore circulation. The real key here is learning to pay attention to patterns. Pain that consistently shows up when you walk and consistently disappears when you rest is not just a normal part of getting older. It's a clear signal from your body, and it's a signal worth discussing with your doctor. Peripheral artery disease is common, and it often starts quietly. But with awareness and action, its progression can be slowed, and serious complications can often be prevented. Your legs do more than just carry you forward. They can reveal a lot about what's happening inside your arteries. If content like this from Health After 50 helps you feel more informed and more confident about your health, we would truly appreciate you liking this video. If you're comfortable, feel free to say hello in the comments and let us know where you're watching from. And we would love for you to subscribe so you can continue learning simple, practical ways to protect your health after 50. Take care of yourself. And always remember, your body often whispers before it ever shouts.